world. Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is, why is my child sick? How do I know why my child is sick?
Well, you don't know exactly, but you can tell, I think, whether your child is sick. After your baby comes home, it will soon develop what I call sleep-wake cycles. In other words, the baby will mostly sleep, but it will wake up to eat. And if your baby sleeps too much or too long, that should be some kind of concern for moms and dads, and would be a reason to take your baby to the emergency room or your pediatrician.
Does breastfeeding help my child stay well?
I think it does really. It's been known to be useful and helpful for a long time. These antibodies in mom's milk are very protective.
If my newborn doesn't wake up, what is the most likely the cause?
Well, infection would be the number one thing. Of course, it could be viral. Babies can get sick from viral infections, but for the most part, if you're talking about a bacterial infection, the most likely cause would be group B, Streptococcus. Now, many babies are exposed to group B and don't get it, and some babies are exposed to group B, get it, but don't get sick from it. So newborns can get sick from it. If they do get sick, they will be irritable and probably sleepy.
What is group B streptococcal pneumonia?
Well, babies can get strep B at two different times. The first time is right after birth and in the hospital. And of course, today with going home before 24 hours, they might not get sick before they go home, but hopefully they'll be able to stay in the hospital long enough that the people in the hospital can tell that they're sick with pneumonia.
What are the symptoms of pneumonia in the newborn?
Well, the first one would be respiratory distress, and there are three components to respiratory distress. One of them is nasal flaring, which is when the nostrils flare when the baby tries to breathe. Another one is retraction, which is when the upper part of the stomach sucks in under the ribs when the baby breathes. That means they're having a hard time breathing. The other one is respiratory rate. Now, normal respiratory rate for a baby is about 40. If it's 50 or 60, that's time to start thinking, or certainly you should be on your way to the hospital by then. The other thing that you have to worry about with pneumonia is that the baby will probably eat less and probably sleep more.
Can babies get meningitis from group B strep?
Absolutely. We talked about Group B strep two times. The first time was right away in the hospital. The second time is meningitis, and that is about 3 months of age. Now, some babies get both. They get pneumonia and meningitis. Some babies just get pneumonia, and some babies just get meningitis.
What are the symptoms of meningitis in a baby?
Well, they will have a headache, although they can't tell us they have a headache. So they're going to be irritable and inconsolable. You can pick them up, try to get them to go to sleep or rest, and they won't. Eventually, if they get sick enough, they will go to sleep and they won't wake up. But you should take them to the hospital when you notice that their respiratory rate is up and they have nasal flaring.
How is group B strep to be avoided?
Well, the best way to avoid it for children, for the babies, is to have mom get treated during labor. And that is with IV penicillin or ampicillin if they're not allergic to penicillin. And if they are, they could try Rocephin or erythromycin or some other form of antibiotics. But antibiotic treatment during labor is the way to go to avoid illness in the baby.
All right. The best place to go is ruraldocallen.com and pick up Pregnancy Your Way. Available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right. That was the Rural Doc Allen podcast, guys. Take care.